we're gonna do how to do a psychiatric eval. So you will take a normal evaluation and then add the psychiatric components into your normal eval. And you'll start out with the presenting complaint, then lead to history of presenting complaint, previous medical history, social history, drug history, family history, review of symptoms, review of history. And then when you add in the psychiatric part of your eval, you'll start out with adding their past psychiatric history. So that includes any medications that they took, and that means you need to know the specifics of the medication. So the dosage of each time that they took it, the dose of each thing, any side effects that they had that may have caused them to have psychiatric problems, and if they had any substance abuse. So if them taking these drugs made them overdose on them or anything like that. Another thing that you need to know is any diagnoses that they've received from a healthcare professional. And then also you'll talk about therapy sessions, and that just means any time that they went to a psychiatrist or anything like that to talk about what was going on with them. Another thing too is you want to compare what treatment options did and did not work for them, so that when you're taking the eval, you can kind of stem off of that. Like if the therapy sessions that were just not for them, then you don't want to prescribe that for them after you figure out what their problem is. Another thing that you include is the forensic history. So that talks about any type of trouble that they've had with the law. So if their psychiatric problem led them to have multiple arrests or inflict any violence upon anyone, that's definitely something to take into consideration. Then you also want to take a detailed personal history, and that talks about everything from their birth until now. So you'll talk about how was school for them? Were they able to make friends? Did they have any traumatic experiences, like were they bullied in high school? Or was school easy for them? Or did they have severe testing anxiety? Were they a smart kid? Or were they the trouble kid in school? You'll also talk about anything that they had to do with work, how their work experience was. Were they able to keep a job for 10 years? Or would they just show up one day and then quit? Would they get fired a lot? Were they recommended by their previous employers because they were good workers, or were they troublemakers that didn't show up on time or caused a lot of problems with the other employees? Another thing, and when you add to the family history portion of a regular history, you want to see how their family environment is. Did they have two parents growing up? Do they have a tight-knit family? Is it just them, or do they have a lot of siblings? Did they grow up poor and have to work for everything, or were they isolated, or just anything? You want a general consensus on how their home life was growing up. And you also want to talk about their relationships, whether that's with a significant other or just with friendships. You want to see if they have a good support system behind them, or if it's just them doing everything on their own. The last thing that you want to talk about is their pre-morbid personality. So you want to know what their life was like before they had these psychiatric problems and just comparing to what it is now. Now we're going to do reflex testing. So you will need a reflex hammer, and this is a standard one that looks like this, or you can get a hammer or something to hit them with. The reflex grading is on a scale of 0 to 4. 0 means that it is absent, they have no response. 1 means that it is diminished. 2 is the normal response grading. 3 is hyperreactive response, and 4 is a clonus response. You'll always check bilaterally to determine their grading, and you'll want both to be the same, but if there's absent ones in both, that is a concern. First, we are going to start out with L4, which is L4/L5, the patellar tendon reflex. So you will literally hit right where their patellar tendon is, inferior to the patella. And the normal response is that they will just slightly kick their leg out. A clonus response means that they will go back and forth. That's not wanted, obviously. And a hyperreactive would be full knee extension. So you're just looking, or just 45 degree. You're literally just looking for a little tap like that. So you'll hit it pretty firmly, and you can palpate it before with the reflex hammer, and then hit down. So
I have hyper.
So that probably would be hyperreactive because it was pretty dramatic. The next one is going to be for the biceps brachii tendon, and that is for C5. So you will palpate their bicep tendon up in here and feel for it. And then for this one, you will hit the reflex hammer on your own thumb where you are palpating, and it is expected for them to curl up just a little bit. So I will hit my thumb, and she had a little bit of a response, and there you go. It's just supposed to be a little curl. The next one is for brachioradialis, and this is for C6. So you will come down here to their brachioradialis on their radius side, and you're looking for them to just flip their wrist up just a little bit. So you'll hit pretty hard, and then that was good. The next one is for C7, and that is the triceps brachii. So you'll have them out like this at 90 degrees abduction and then 90 degrees of elbow flexion, and then hit their tricep right there. And just like she reacted, you want them to come out just a little bit into extension. Then the last one is for the Achilles, and this reflex tests S1 and S2. A normal reaction is that they will plantar flex their foot. So you'll have them lie prone on the table, and you will hit their Achilles tendon, and just like she has, it will plantar flex just a little bit. And like I said before, you will compare it bilaterally just to make sure that it is the same on both sides. If they have an abnormal response, which is the diminished, completely absent, hyper-responsive or clonus, it could be indicative of a nervous system pathology, and you just want to kind of look into it more in depth because you may need to send them.